Hi everyone, please take a second to fill out the poll and introduce yourself in the chat. Thank you for joining our webinar today on sleep and COVID-19 with Dr. Tony Cunningham. I'll be turning things over to him shortly, but first I'd like to review a few housekeeping items with you all. Participant microphones have been muted and this webinar is being recorded and will be available for viewing at a later time on the MHTTC website. The PowerPoint slides and any additional resources discussed today will be available as well. During the presentation, if you have any technical difficulties or questions about the topic, you can use the chat box on the left. And those attending today's live event will be eligible to request a certificate. And more information regarding CEUs will be in a post-webinar follow-up email. And to reach us after the webinar, you can email newengland@mhttcnetwork.org. Our MHTTC's mission is to use evidence-based means to disseminate evidence-based practices across New England. Our area of focus is geared towards recovery through recovery-oriented practices and support services within the context of recovery-oriented systems of care. To ensure the responsiveness of our work, we will actively develop and maintain a network composed of different stakeholders from each of the 6 states to guide our activities. And with that, it is my pleasure to hand it over to Dr. Raquel Meshlam-Gately.
Thanks, Rachel, and good afternoon, everyone, and thanks for joining us today. My name is Raquel Meshlam-Gately, and I'm a psychologist from Beth Israel Deaconess Medical Center in Boston, involved with the New England Mental Health Technology Transfer Center. And it's nice to see so many attendees as well as broad representation across several disciplines and community groups, from clinicians to researchers to people with lived experience and so many others. I'd like to welcome all of you to today's webinar, which is part of a series of initiatives led by our MHTTC on the mental health effects of the COVID-19 pandemic. We will be regularly updating these initiatives on our website, and we welcome any suggestions for other resources we can provide for wellness, recovery, and connection during these challenging times, not just for the people you serve, but for yourselves as well. As I'm sure you're all well aware, the pandemic is causing a historic rise in mental health problems, and many people are reporting significant changes in sleep. To that end, we have invited our colleague, Dr. Tony Cunningham, to address this important topic, both through his presentation and any questions you might have in the end. And we're really hoping that you won't be shy about asking questions, providing comments, or sharing ideas and resources. Feel free to type those questions, comments, and ideas into the chat box as you think of them, and Dr. Cunningham will address them right after he finishes his presentation. So with that, it is my pleasure to introduce Dr. Cunningham, who is a postdoctoral research fellow at Harvard Medical School, Beth Israel Deaconess Medical Center, and Boston College. Dr. Cunningham's long-term research focus is understanding the role of sleep in emotion and memory processing and how knowledge of these systems can be applied to clinical populations. His latest research has focused on the behavioral, neural, and autonomic effects of sleep loss on the perception and memory of emotional information. In choosing to pursue clinical training within a cognitive neuroscience lab, his background has provided preparation to carve a niche at the intersection between cognitive neuroscience and clinical practice. His ultimate goal is to pursue questions like these in the context of sleep and utilize his research findings to develop innovative treatment ideas to benefit healthy and clinical cohorts alike. So without further ado, welcome Dr. Cunningham for joining us today to speak about the importance of sleep during a pandemic and its relationship to mental health.
Thank you. Thank you for having me. Thank you for so many people tuning in to hear from me, and I've really appreciated the staff putting together that poll. They've been great for all this, just to see a little bit who I'll be talking to today. Super helpful. And yeah, thank you all for thinking me and thinking of this really important topic during this time. And I do just want to reiterate Raquel's comment that especially if you have like ideas or comments related to sleep during this time, it would be great for you to use the chat function to share those and think of some other ideas. And I did actually try to keep it relatively short so I can get to a lot of questions. Hopefully, this will stir up some pretty good conversation. So, yeah, feel free to put them in the chat, and I will do my best to get through as many as I can when we're done here. So, without further ado, we'll dive right in. We're going to be talking a little bit about trying to sleep during a pandemic, which I'm sure most of you can imagine is easier said than done. I have no conflicts of interest to report related to this work. So I'm going to give you guys a little bit of an outline for what I have planned for you today, and I think it's going to really fit in well based on seeing who the attendees are. We're going to start with talking about why is sleep so important right now? What is it about sleep that makes it something that should be at the forefront of our minds on kind of a daily basis even, something that we prioritize? The second is going to be how to sleep during a pandemic. Again, a lot of stress going on, a lot of things that are pulling us in a lot of different directions. How can we prioritize sleep? What can we do in order to make sleep happen? And then the last is I'm going to talk to you a little bit about researching sleep during a pandemic. Obviously, research all around the world has been impacted and changed through this, so what can we still do to study sleep? I'm going to tell you a little bit about a research project I got up and running during this time. So first and foremost, why is sleep so important right now? And I know we're here to talk about the mental health aspects, but I gave myself one slide to talk to you about really the medical reasons why we should be sleeping right now. And it really has to come down to sleep's role in the function of our immune system. So sleep is actually a critical component for our immune system to be functioning optimally. Nocturnal sleep readies the immune system for infectious challenge, so it reduces inflammation, and it also reduces the risk of infection. What sleep does is it actually supports the release and production of cytokines, which is a protein that helps the immune system respond to antigens or foreign substances that enter the body, which help the body's immune system kick in. So when we are sleep deprived, that system is not working as effectively or as efficiently. There's been several studies of this that have really indicated this, some of which are particularly poignant given our current situation. One of probably the most well-known ones is that a study of participants ages 18 to 55 found that if those with reduced sleep had an increased likelihood of being infected by the common cold. And guess what? The common cold is a virus. So your immune system is just not as strong and is not able to fight off those things when you are losing out on sleep. And also we know that chronic sleep restriction, so we're under a period of chronic stress right now, so people might be having regularly difficulties with sleep, would not be surprising. So that leads to higher levels of cortisol, stress hormone, increases your blood pressure, and this is really an important point. It has the usual number of antibodies that even a young person has to a flu vaccine. So you get as 50% the response to a vaccine. So, even if, or hopefully when, let's put it that way, when a vaccine for COVID-19 is developed, it really is going to be even critical at that point to be sleeping well to make sure that you maximize the effect of that vaccine. So right now, as far as what we have available, obviously there are treatment measures, but as far as what you can do on a day-to-day basis, along with social distancing, as far as what's going on biologically within your body, sleep might be currently our best defense against COVID-19, keeping you safe and healthy. All right, so that was my one medical slide. So let's go ahead and get into the mental health side of things. So we'll talk a little bit here about sleep and mental health. So I don't think this would be surprising for most of you tuning in that chronic sleep problems affect a huge proportion of the patients that come and see us for all types of things. So 50 to 80% of patients in a typical psychiatric practice report sleep disruption, compared to only about 10 to 18% of the adults in the general U.S. population. So sleep seems to be a critical component that frequently breaks down when we are struggling with mental health issues. Sleep disturbance is the most prevalent symptom in depression, occurring in 90% of depressed patients. And I love this stat. 90 to 100% of Vietnam-era veterans with PTSD reported disturbed sleep. 90 to 100%. Basically, they're saying they've yet to find a Vietnam-era veteran with PTSD, but they're leaving a little bit of room for error in case one of them popped up. So, so it really is, integral into these major mental health concerns. And for a long time, a long time, it's a long-standing belief that, exploring sleep issues was a lost cause because everybody had them. It was just a symptom of other disorders. You'd have depression, you'd have PTSD, and as a result of having depression and PTSD, you would then also have sleep disruption. But a lot more contemporary research really has highlighted that is most likely not the case. Sleep, what it seems to be instead is that sleep disruption may exacerbate, trigger, or even cause impaired emotion regulation and psychopathology. So rather than just being, the outcome of a mental health disorder, it can actually generate and lead to issues with mental health. And so it really has become this really nasty kind of feedback loop where it's very circular, where if you are having mental health issues, then chances are you're going to have sleep difficulties. And if you're having sleep difficulties, then there's a higher proportion, higher likelihood that you'll have issues with mental health, and it becomes this really nasty circle. So if you're, anxious all day, it impacts your sleep, you're not sleeping as well, you have a restless night, well, you're going to be more prone to having anxiety the next day. That just means there's a lot of different ways to treat it, though, as well. So that gives us lots of room for attack. So you can attack either the mental health side of things or the sleep issues, as I'll talk a little bit more about momentarily. So as far as what's going on in the brain, I'm just going to give you kind of a really quick bird's eye view of what we know, and that's primarily what we see going on in the amygdala. So after sleep loss, even in healthy cohorts, our amygdala, which is the emotional center of the brain, the area that lights up whenever we're responding to something emotional, it becomes hyperactive to emotional stimuli. And what we think is going on, this is still like an open area for investigation. It's an area that, I plan to take a lot of my research. But what we think is going on is that the frontal lobe, which is super important for, judgment, decision-making, things like that, the frontal lobe of our brain does not function as well. Basically, when you're sleep deprived, a lot more of your basic instincts take over, and you're not doing some of that higher level cognitive functioning. And one of the things that frontal lobe helps us do is it helps us put the brakes on the amygdala. So if our amygdala, so when we're sleep deprived, basically the brake systems, we think the brake systems come off the amygdala and it just becomes super responsive and super hyperactive. So the things that may not have seemed or may not have triggered as much of emotional response earlier are now creating huge emotional responses. And I'm sure those of you that are clinicians can kind of see where this is going, that, people that are sleep deprived, they might be slighted in a way that then triggers the emotional centers of the brain. They're unable to use cognitive control, cognitive reappraisal, some of those more higher level systems for processing emotional events, and then that just exacerbates their symptoms even more. And what's interesting, so this is a quick picture here that just shows that, when people see images that they've been previously encountered, so they've seen these images before, and after a night of sleep, the amygdala reactivity actually goes down, so you actually reduce your activity, but when you're sleep deprived, you get, really hyperactive response to that. And what's interesting is we see these same neural features in a variety of mental health disorders. So without even taking consideration for their sleep, we're not necessarily relating this response to their sleep, although I would hypothesize that it's related. That's kind of where the research needs to be done. You still see the same neural response if you just brought someone with depression, with anxiety, with anger or aggression issues, or with personality disorders. You bring them in, put them in a scanner, whether or not they've been sleep deprived or not, their brain tends to look more like the sleep deprived brain. And along with that, we know that they're probably having some sleep issues. So that's where it comes. And then, like I said, if we then attack these insomnia symptoms, if we treat these insomnia symptoms through things like cognitive behavioral therapy for insomnia, which is currently kind of the gold standard as far as a therapeutic treatment for insomnia symptoms, this has been shown to effectively reduce other psychiatric symptoms. So there's absolutely research out that shows that if you treat the insomnia symptoms, if they have anxiety and depression, those also come down. The symptoms of anxiety and depression also come down. So that is sleep and sleep loss under the best of times. So we are in the middle of a pandemic, and you know, one of the things I tried to do when putting the slides together was be as blunt and forthcoming as possible. And frankly, we're living in a coping strategy dystopian nightmare for both patients and clinicians. So I still am doing some telehealth, and I have a small caseload of clients that I'm seeing. And for those of you that are also mental health providers or other types of providers, you know, it's really tough right now to help some of my clients cope with the situation. And the big part of that is that a lot of our previously reliable coping strategies may just not be available right now, or may cause so much additional stress in trying to do so that they're not, you know, they're not generating the stress-reducing effect that they normally would. So right now, can't really visit family and friends. We can't do any physical contact of any kind. I have plenty of clients that are just missing hugs. They just want to be hugged. It's been weeks since they've been hugged by somebody other than maybe their roommate, or they're living alone. So working out, going to the gyms, that's been cut out. Restaurants, shopping, movies, all of those things where you can go out for a little bit as a distractor, those have all been cut off from us for the time being. And even now, as things start to open back up, there's no telling what's going to happen, right? We can't say, okay, well, in July you'll be able to do this again. No, we're not sure about these things. So that's why we really got to start doing planning for that now. And so, you know, one of the things I think clinicians need to do is really start helping patients learn to rely on and to think about what solo coping strategies might they be able to engage in. And I think there's just really a need to get creative, and I put get creative and explore uses of technology on 2 lines, because I don't think to get creative, it doesn't necessarily mean Zoom parties or FaceTiming more with friends and family, although I do think there's a place for that and I should be encouraged. But, you know, you get creative with types of hobbies, puzzles, knitting, things like that, that they could do that they may not have thought of. And so, you know, some of those worksheets where you just be like, would you be willing to try any of these, could be particularly useful right now. And I think the last thing is to really reinforce self-care techniques. And the one I would always start with my clients is sleep. Almost every one of my clients, we spend probably about 3 to 5 minutes every session talking about their sleep for the last week, and it tends to really help them kind of focus on it. And frankly, there's a storm brewing. You know, as far as mental health concerns go, a storm is on the horizon. And I know a lot of you probably heard about this really sad story, really terrible story with Dr. Laura Brewing, who's a ER doctor on the front lines of COVID-19. She actually contracted COVID-19, took a couple weeks off, got better, went right back into the thick of things, and she actually died by suicide. She ended up dying by suicide. And, it's really a sad and disheartening story. And unfortunately, my fear is that this is just, the first, spotlight on what could be a potentially growing problem. And so to talk about this a little more and break down the things that I think we all should be thinking more about is, first of all, healthcare and frontline workers are just going to need significant support. Like, that is a talk of its own. That is something that I think we all need to figure out how to, aggregate our resources and come up with strategies to take care of these people that are doing so much for us right now. And that's, any essential workers right now, first responders, obviously doctors, nurses, the like. So that's a whole nother talk, like I said. But one thing, this is not news, that social isolation, right, is related to suicidal behavior. This is, I found this quick quote from a 1980 meta-analysis, and so this is not news to any of us. So again, I'm not going to spend too much time talking about it, but certainly, being separated and apart from loved ones Even if you do happen to have roommates or be having, live with a family, you're still not getting the same amount of social interaction as you normally would, and we as humans are social creatures. So this is obviously going to be a fundamental part of impacting our mental health during this time. Another one I wanted to point out is that unemployment in the U.S. has just crossed 20%, or there have been 26.5 million jobs lost since the start of the COVID-19 pandemic and counting. 26.5 million jobs. This is the most significant job loss in decades, obviously, and so that's going to have a major impact. And then there's then insomnia symptoms are also on the rise. So none of my clients would fall under this category, but I have talked to other mental health and medical professionals that have added COVID-related insomnia as a diagnosis to their program. So something that they might diagnose. So these are things that can be particularly relevant to the actual ongoing events. So the stress, the people checking the numbers of the outbreak every day and things like that, the uncertainty of when this is all going to end is certainly weighing on people, and probably plenty of you and me listening right now. I'm sure it's weighing on plenty of us too. So we got to be really careful and think about how it's impacting us in our sleep. So to talk real briefly about the suicidality and unemployment, obviously this isn't my particular area of expertise, but I did find a study that looked at deaths by suicide shortly after the 2008 economic crisis. And what they found is really the economic crisis itself wasn't the main driving factor for suicides during that time. So you can kind of see a little bit of an uptick here in some areas at 2008. What it is really it's that regular unemployment numbers. So even in the best of times, unemployment is highly related to suicidality, and to the point where suicides associated with unemployment totaled a 9-fold higher increase in number of deaths than any excess suicides that could be attributed to that particular economic crisis. So in this case, it may not be so much the actual economic impact of this, but potentially the lasting impact on employment. So that is going to be something that you want to talk about with clients, loved ones, and things like that, people that may have lost their jobs. Be sure to check in with them regularly about this. And then suicidality and insomnia. So insomnia has been shown to be an independent risk factor for suicidality. So what we know is that suicidality is typically a pretty acute period of emotional turmoil. So there's a lot of reports by people that attempted suicide that immediately after regretted it. I believe there's a study of people that jumped off the Golden Gate Bridge, and then they interviewed most of them afterwards, and an incredibly small proportion went on to eventually die by suicide, and a vast majority said that immediately after their feet left the bridge, they regretted their decision. So a big part of suicidality is that it's short term, and it's an acute period of turmoil. And what sleep loss really sets the stage for this type of turmoil. So if we don't have sleep, if we're missing out of sleep, we're more inclined to be focusing on the negative, and we're also more inclined to have vulnerable emotions, and it impairs, again, that frontal region of the brain that is really important for cognitive control, decision-making, planning, things like that. It gets way damped down, and so it impairs our decision-making, and we're more likely to engage in high-risk behaviors, and that's why sleep is so important for weathering this type of thing. And so they did a meta-analysis a few years back, a huge meta-analysis, almost 150,000 participants, and found specifically that sleep disturbances were associated with a risk for suicidal ideation, suicide attempts, and suicide decedents, even when you control for depressive symptoms. So even if you control for depressive symptoms, the sleep disturbances by themselves are predictors for all of these things. So that's why it's so important to focus on them. And this isn't the only part of sleep. So one other thing to think about with sleep isn't just what's going on in the brain or the fact that you're tired and things like that, but also what is available to you in the middle of the night. So one of the things to think about is one of the things that people have studied is what's called nocturnal wakefulness. So it's basically being up during the late hours of the night. And what they found is when you control for the proportion of the population that you expect to be awake at any given time, then the peak incidence of suicide occurs between midnight and 3 a.m. So you think about during this time, and in fact, at midnight itself, there's an 8-time greater risk at midnight than any other time during the day, or based on what you would expect, based on the number of people that are awake. And you think about that, again, you're entering into that period of the evening where you're furthest from sleep, you're most tired. Even if your sleep slept well the night before, that's going to be the period where you're the most tired, and your judgment's going to probably be at its worst. And you are and you're frequently alone. Again, we get back to that social isolation. So there's not necessarily as many people around you. There's not as many resources. You can't likely go to the movies or go shopping or any of those things at midnight. And so that is, confers a greater risk just being awake during those hours of the night. So it's something else to consider when you're working with clients and thinking about other people. Okay. So now that I've delivered all of the bad news, I'm not going to just leave it there. I'm going to tell you, hopefully, give you at least some suggestions for how you might address this, right? And not leave you hanging with such terrible news. So sleeping through a pandemic, what can we do? And, I've done a lot of reading on this recently to try to kind of hone in on the best advice I can give for you. And those of you with experience with CBTI or CBT for insomnia, most of the advice is going to be the same. There's not a huge shift given our current situation. And so the number one piece of advice I would give is to maintain a regular sleep schedule. So this especially goes for your wake-up time. And the reason that is because if you have a really bad night of sleep, let's say you usually sleep from midnight to 8 a.m., and for one night you're up till 4 in the morning, and then you sleep until noon, and then you're not tired until 4 a.m. the next night. And then it becomes like this perpetual cycle where you just keep staying up later and later, or you might get more and more disjointed sleep. And right now, a lot of us have the flexibility that we might be able to sleep in later. A lot of people, particularly without kids, I would say, as my personal experience goes. So a lot of people, might be able to sleep in a little bit later. And what you really want to do is have them continue to get up out of bed. So even if they struggle with sleep for a night and don't fall asleep till 4 or 5 in the morning, still have them try to get out of bed at around 8 in the morning. Because then by the next night, come midnight, come their normal bedtime, they're just going to be exhausted. They're going to be riding on 3, 8, 4 hours of sleep, and then chances are they'll be able to fall asleep a lot easier, a lot faster. And so that's why that wake-up time is particularly important. But basically, just keeping your body on a regular schedule is also just critical. We have these natural circadian rhythms, and we really want our sleep to line up with our circadian rhythm, because it's not just the things I've talked about. Sleep and your circadian rhythm has huge impacts throughout your entire body. So there is the immune system, there is the inflammation, there is the neural effects, but there's also the way you process food, there's the way that you have energy for the next day. All of these things can be shifted and be less optimal if your sleep is moving all over the place. And one of the research studies that's been done on this has shown that even under normal conditions, people that have regular sleep schedules have better quality of sleep, their melatonin is released earlier, and they get better grades. So this was with a college sample, and they found that the regular sleeping college students got much better grades. And I'll admit I was not a regular sleeping college student, and that might explain some of my grades. I'm not going to give full credit, but I will take a little bit of the heat off my college undergrad degree at least. So I wish I'd known that in undergrad. So what you really want to do is try to focus on maintaining as close to a normal bedtime and rise time as possible. That's number one, by far my number one piece of advice. Beyond that, there's lots of other things to do and to try, and kind of my recommendation for all of this is if you are struggling with sleep, or if you know someone that is struggling with sleep, these are the things to try to do first. These are kind of your first line of defense. Experiment with things, try different things. See what works best for you, what has the biggest impact on you, and because it's really different for different people. Some people are really sensitive to light, which I'm about to talk about. Some people aren't. And so most people are. I will say light. Light is probably the number 2 biggest one. So one of the things we recommend is to get light in the morning. So as much as you can, get out. And so I have this little diagram on the right-hand side, and you can kind of see here that direct sunlight is at like 100,000 lux. So like real, and that is the biggest driving factor of our circadian rhythm is light. So light is what tells our body when to get up and motivated, and turning off light at night is what helps our body wind down and starts to release the melatonin. And you can see that direct sunlight is 100,000, and if we're in our classrooms or homes, I mean, we're getting like 100. Like that is, 1,000% decrease, or 1,000 times less than what you get when you go outside. So you really want to try to get outside, get 20, 30 minutes of sunlight, direct sunlight if you can, in a safe way, obviously. But they even found that workers that got more morning light or just worked by a window. So if you can make your workspace at home by a window, that's going to really help as well. Another thing is to try to de-stress and avoid negative news before bed. We encourage people to stay informed, but there's no sense of going down the Twitter or Facebook or Instagram or Reddit holes right as you're trying to drift off to sleep. So instead, create a buffer zone before you go to bed. So 45 minutes to an hour, turn off the phones, start winding down, get in a normal routine, read books, things like that. That will generally help you drift off to sleep a little quicker. Big part of that is, like I said, curfew for electronics. So, some research that's been done has shown that bedtime mobile phone use predicts less sleep. It also increased insomnia and increased fatigue. So the more you use your phone in bed, in your face, or as you're falling asleep, and I'm sure most of you have heard about like the light, and again, that's impacting your melatonin release, also introducing stressors into your body. So you want to avoid that. One thing to consider during a pandemic especially is that this putting down the phones right now might be increasingly difficult because we're isolated. So our technology is one of the things that's currently helping us feel connected. So it's kind of a double-edged sword in that sense. So we want to feel connected, but we need to do it at appropriate times. We need to put them down when we're getting ready for bed. And again, that's if you're particularly struggling with sleep. Again, avoid excessive time in sleep. Avoid excessive time in bed. So what you want to be sure you're doing is not staying in bed all the way until midnight. If you're getting 8 hours of sleep, but you're laying in bed for 12 hours, that is really going to set you up for insomnia, because what happens is you're probably spending a lot of those extra hours staring at the ceiling, worrying about things, and then you get stressed about going to bed. So again, rather than spending too much time in bed, get up in the morning when you normally get up, and then just try it on the next night. One night of sleep is not going to affect that much. And that's where I get to the final point, and this is so important for clinicians to do, is to normalize some level of acute sleep disturbance, especially right now. It is okay for people to have a really bad night of sleep or a couple of really bad nights of sleep. Help them feel like that's going to be okay, and help them know that your body can recover from that and it's not a big deal. Where we get into trouble is when people start to get stressed about the thought of going to sleep. So that is where the insomnia symptoms really start to creep up, when people stay awake later and later because the thought of lying in bed and staring at the ceiling for 5 hours is not very enticing to them. And what can actually happen is just the pure thought of going to bed becomes stressful. And so that's releasing cortisol, the whole cycle. It's engaging your fight and flight response is going to keep you awake. It's certainly going to disrupt your sleep. So what we really want to do is have our patients, understand that a little bit of sleep loss is going to be okay. And what we say, again, back to the excessive time in bed, their bed should really only be a place for 2 things, and that's sleep and sex. And so if they're not engaging in one of those, if they're struggling to fall asleep, it's also okay to get up for a little bit and do something else. Try to avoid those screens. Try to avoid things that will stress you out. But if they're on hour 2 of staring at the ceiling, maybe get up and do something for a little bit, and then lay back down when they're feeling tired again. So here's just a laundry list of other things to try. So physical activity and diet. Sleep, physical activity, and diet are another circular, they all impact each other. They're all interwoven together. So you really have to consider how all of those things are impacting you. I would argue as the sleep researcher, as I'm sure any exercise and diet researchers would argue, that sleep is the most important, because in order to maintain your motivation and your desire to do physical activity and diet, I think you really need that sleep. That's my case, but I'm sure people have different ideas. Also, a hot shower about 90 minutes before bed, that actually has been shown if you heat your body up and then you let it cool down, that will actually accelerate your melatonin release. So that's doing more than just reducing stress. That's actually having a physiological response that's helping you go to bed. Avoid caffeine after noon, right? So I don't know how many of you are watching me right now with coffees in hand, but one thing I would recommend, and again, this is if you're struggling with sleep. I'm not trying to take a coffee away from you right now, but if you're struggling with sleep, one thing I recommend doing is to cut off your caffeine intake after noon. And the reason that is one of the coolest new facts that I learned a while back, is that caffeine actually has a half-life of 6 hours. So, if you drink your giant mocha frappuccino at 6 p.m., then half of the caffeine that you intake at 6 p.m. is still running around in your brain at midnight. And at noon, even if you stop at noon, then a quarter of that caffeine is still running around your brain at midnight and helping to keep you awake. So you really got to start thinking about how caffeine might be involved. You also want to avoid too much alcohol. Alcohol just fragments your sleep. It is a sedator. It is not a sleep. It does not really help you sleep. It helps sedate you so that you can fall asleep maybe, but all of the things that alcohol does to your body fragments sleep, and it sets you up for a worse night of sleep, a less restful night of sleep. You want to nap responsibly. Again, quick power nap here and there can be super useful, super good for you, but if you're doing it too close to your bedtime, it could just make it that much harder to fall asleep at night, and it can become kind of a negative cycle. So you just want to be sure you're napping responsibly. Relaxation techniques, meditation, there's a lot of great apps for this. I know I just say get your phones out of your face, but you got to weigh the pros and cons of that. Also, other ways of getting connected through those would be great. And then if you need to, you can try, if it gets to the point where it's full-blown insomnia, or you have patients with full-blown insomnia, I would always recommend establishing CBTI treatment. And just so you know, there are directories hosted by Society for Behavioral Sleep Medicine and the University of Pennsylvania. There are a couple of directories hosted that could be really useful for helping to locate them. So it's basically finds providers all over the country, and then obviously medication if needed. So I wouldn't even say that's necessarily a last resort. I just try to go with the other treatments first. Okay, so I really do think that sleep impact of COVID-19 is going to be a tale of two cities, and this is not research-based. This is my own conversations. This is mostly anecdotal evidence, but obviously many individuals are reporting worse sleep and increased insomnia symptoms. They're likely, there's plenty of people out there that are directly impacted by COVID-19. Either they or a loved one got sick or maybe even passed away due to it. There's incredible amounts of stress going on. They're under chronic stress, food insecure people, housing issues, and housing issues can be more than not having a home. Housing issues can be, my parents downsized their house and now all 8 of our kids are jamming into a 3-bedroom house or a single room, right? I mean, thinking about the differences in socioeconomic status, there are situations in which people just do not have a comfortable, safe sleeping environment and that that a lot of us take for granted. Financial difficulties, as I talked about with unemployment and other financial stressors, and $1,200 one time is not going to certainly help a lot of people weather this for that long. Difficulties transitioning from work life to home life, so things like that, and as a loss of coping strategies, as I mentioned, and then loss of child care. So parents, I see you, okay? I just want you to know, I see you, I feel your pain. I love spending more time with my 2-year-old daughter. Just before this nap, she had a meltdown and wanted me to put her down for a nap. I love doing that, absolutely love doing that in the middle of my day. It is certainly, taxing. And my wife is also a nurse, so there's several days a week where it's just me and my daughter. And so it absolutely is a change. And, there's a lot of good that comes with it, but it infuses a lot of stress, not getting a lot of me time these days. Those are the things that could be going wrong, but there are some individuals. I have plenty of my friends that are still in grad school or early postdocs that are reporting actually better sleep. So, they are relatively unaffected by the devastation of COVID-19. Neither them nor anyone they know directly has been impacted. They're doing a pretty good job avoiding unpleasant, or they're highly adept at coping to the news. Working from home has actually been beneficial for them. Maybe they have a nice open space and no commute time. Makes it more flexible so they can actually get just as much, if not more, work done. They're financially secure, or perhaps even benefited. Some people have established a quarantine, which is what I've heard, quarantining, in which they might have a few social networks or family members that they're still getting together with to spend time with, which again, they're basically agreeing not to go out and interact with other people, or doing it as little as possible and only spending time together to prevent the spread. And then, again, a lot of these people that I know personally, at least, don't have children to chase around all day and try to manage. So I really do think we're trying to take into account as many different factors that might be related to this. So really quickly, I'm going to try to breeze through this to make sure we have plenty of time for questions. I launched a sleep research project during this pandemic to get a little bit more information about what might be impacting our sleep and things like that. Our typical sleep research options these are kind of the main ones. One of them is polysomnography, which involves, participants coming to the lab, and we hook them up to a whole bunch of stuff, and obviously a lot of hand touching, a lot of close contact. That is off the list. We can't really bring people in to that type of really in-depth sleep training. Polysomnography is what we call the kind of gold standard right now. It really helps you not only really accurately reveal their sleep, but there's different sleep stages, and that's polysomnography that helps us do that. There's also actigraphy, which are these watches, even to some extent Fitbits and things like that, can monitor sleep to some extent, and so those are pretty good too. The ones specifically designed to do it are better, but there is more and more research coming out that even your Fitbit is doing a decent job at least giving you gross estimates of your sleep. And in fact, there's one study already that has come out, and it integrated a lot of data, and the initial surge of kind of response to COVID-19, more people were sleeping, but there was also significantly less movement. So people were sleeping more, moving less, and they were able to tell that because of Fitbit response. And the last one is subjective sleep logs, and so doing kind of sleep diaries, just reporting when you fell asleep, how long did it take you to fall asleep, things like that. And so really it's very difficult polysomnography is currently off the table. Actigraphy would be somewhat difficult. You'd have to coordinate sending them stuff. That really leads us to these subjective reports. And anytime you go into kind of the subjective domain, there's a little cause for concern, but research has really backed up that these are a reliable source. So there's about a 90% overlap with PSG. So just they brought people in the lab and they had them do both sleep diaries, and they recorded their sleep, and they were really highly correlated. So we know that we're still getting some pretty good information just by asking people to reflect on their sleep from the night before. So we launched this online survey study. It's a longitudinal daily survey study. And these are the main points of it. So first of all, we want to know if there's any sleep or activity behaviors that give any additional protection or risk of contracting COVID-19. So obviously we'll be looking at short sleepers versus long sleepers, people that get out and are in the community more versus people that are social isolating, things like that. But then what we're really also interested in is determining the societal impacts of COVID-19 and all these large-scale measures, these stay-at-home orders and school closures, and how they relate to factors related to mental health, such as sleep, stress, and mood. And then we'll take these factors that change and associate them with psychiatric outcome measures. And then our last thing we're really interested in doing is looking at how really important demographics such as age, race, LGBT status, and things like that, how those affect all these relationships. So I'm just going to breeze through real quick and show you what I have some demographic numbers. So recruitment has gone really well. These are numbers as of last Sunday. We have over 1,800 people that consented, and about 1,500 people are actually fill out the demographics, which then they'll start receiving the daily surveys. We're getting responses from 60 countries across 6 continents and 20 different time zones. In the U.S. itself, we have responses coming in from 46 of the U.S. states. So we were able to get into Hawaii and Alaska, but I was not able to find anybody in the Dakotas, Wyoming, or West Virginia yet. We're still recruiting, so never say never. The age range is pretty wide. We have 18 to 90 years old. I was fortunate that the lab we got started up in had an older adult sample that they typically sampled, and so we were able to go to them, and about 17% of the sample is 50 years or older, which is great given how this disease is impacting the older generation. It's going to be really important to look at those age factors. It is primarily female sample when you look at biological sex and gender, which just goes to show, women are going to save the world. But then when you break it down to gender, we do have a little bit more diversity with 77% female, 19% male, 2.5% non-binary, third gender, or self-described, and 1.3% identify as transgender. One aspect that we are really looking for, I'm really excited about, is that about 20% of our sample reported being a member of an LGBT group. So that'll help us look into that. Here's the race and ethnicity breakdowns at the moment. Again, heavily white. So we're going to have some limitations in determining how this situation is impacting different races and ethnicities. But again, parents, I got 33% of my participants are parents, so we'll be able to do a little digging into how having a kid at home might be impacting things these days. And so what we do is we have them consent to all these demographics, and then we have them do full survey for a couple of days. Then we get them in a rotation where they're doing a short survey 5 days a week and a full survey 2 days a week, and those are kind of randomized. And so I presented the demographic data first so you guys can start to think about what we'll be able to tell based on those demographics about how these different groups might be faring during this time. But one of the things that we are collecting is obviously sleep reports. So we're going to get things like sleep duration, sleep efficiency, which is another measure of how well they're sleeping, and dream reports. And I know that there's been a lot of interest in dreaming lately, and I'll say that for kind of questions if people have that type of question. In the short survey, we also get activity, contact with others, socialization that they're doing, exercise, alcohol consumption. We're getting some coronavirus status and symptoms that they might be experiencing. Then in the full survey, we collect all those same measures. So we're getting all those measures every day of the week. And then 2 times a week, we're also getting reports of mood, using the PANAS. We're doing some stress questions, and we're doing the PHQ-9 depression inventory, except suicidality. Our IRB did not want us to be collecting that for liability purposes. And so our study launched on March 20th, 2020. As of Sunday, we've been assessing for 52 days, and we had 23,000 responses to our daily surveys. I checked this morning, it's closer to 25,000, and we've only had about 2.3% of the cohort withdraw or be ineligible. So it's going pretty well. So our current timeline is we're going to continue daily assessments through May 20th. After May 20th, we're going to transition to 2 times a week, and we're going to assess through June 20th. At minimum, we're also going to do at least 1 long-term follow-up in the fall of winter to see how things are doing. And all of this comes with the caveat that it's currently a fluid situation, so things could change depending on how the pandemic changes. We really don't know. And then finally, we're releasing a series of 3 additional batteries that are going to look into all of these things. So I told you about the data that we are collecting, but we're really interested in how a lot of different things might be impacting things. So typical emotion regulation strategies, pro-social behaviors, empathy, personality traits, all of these things. How are these factors related to their outcomes and things like that? So as far as research advice during a pandemic, the number one thing I would say is be understanding. We've made everything optional. We tell our participants on the days that you feel you have the time and energy to do it, do it. If you don't feel like doing it, that's okay. And that has really helped. I think that has really helped us maintain the large number of responses that we've been getting. Be grateful. I really toe that line of being overly grateful to our participants, like while it's consenting, but I let them know that what they're doing is important and that we really appreciate their responses. I've been communicating a lot with our participants, and they seem to really enjoy that, and it keeps them feeling connected. So I think during this time in particular, there's an increased need for communication. Also, I think it somewhat serves that purpose that there's such a lack of communication that basically anytime they feel connected is a good thing. And then be human. And I think that all of these things go into that one. Like understand that there are issues and things like going like that. That people have other things to consider. So right now our research team is incredibly small. It's me and my co-PI, Elizabeth Kensinger at Boston College, and our lab manager. We had to keep it small in order to get up and running. One thing I forgot to mention is that we do plan on making all of the data that we can open access as soon as possible. So that's what we are applying for funding to do, is to turn this data and make it into something that not just us, but researchers from across the globe can use to answer questions. Might be really important to do if there are future outbreaks and things like that. And so, I want to definitely thank them for all their help in doing this. And thank you all for your time and attention. And I will do my best to answer as many questions as I can right now.
Thank you so much for that wonderfully informative and helpful presentation, Tony. We'd like to now open this up for your questions, comments, ideas, any resources that you might want to share. And as I mentioned at the beginning, please don't be shy. We're really hoping to learn from each other through this. One question that I'd actually like to start by asking, which I see somebody else commented on too, is dreams. There's been a lot of reports of more unusual and vivid dreams, increased dreams, nightmares. Can you speak to that a little bit more, help us make sense of that a little bit?
Yeah, so, I'm not one for interpreting dream content too much. My advisor, if any of you look up Jessica Payne, WSBT News, she has a great article, a little interview that she does a great job describing this. So, you can look at content and it might get you some information, but I think what's really most important is the tone, the emotional tone. And it really is a fascinating thing. Like I haven't gotten a chance to look at our dream reports yet. We have, last time I checked, we had over 8,000 dream reports. So we're really going to be able to take a look at it. But there seems to be, this increase, this phenomena of societal global increase in these really intense dreams. And there's a few theories as to why that might be. One of them is that, it's your brain trying to cope with what's going on. If you have a dream before a big meeting that you're running late or something like that, it tells you maybe not so much about the content, but the emotional tone can kind of tell you that you're under stressful circumstances. So that it's your brain kind of taking in all these stressful circumstances and process it during sleep. And so lots of times when that happens, it outputs some really kind of nutty and stressful stuff. And so that is absolutely one thing that could be going on. Another theory is that it's actually helping prepare us to deal with the COVID situation. So if you are having stressful, anxiety-producing dreams at night, you may be more prone to engage in pro-social behaviors during the day. So what I think is that's saying is, like, if you are have a dream that that you're out of food, or you get sick or somebody else gets sick, that might stick with you during the daytime hours, and it might make you engage in a little bit more social distancing and things like that. But yeah, we don't really know. I hope to be able to shed some light on it. There's still a lot of theories out there as to what dreaming is all about, and that's what we're thinking might be going on during this time. But it's really fascinating that it's kind of such a global effect. And I see some other chat questions, so I think I'll just go ahead and dive right in. So some people asked about increased hours of sleep. And I do see that if I don't get to your question, I can try to answer some during a follow-up email, so I'll also plan on doing that. So what about increased hours of sleep? I think that's just something to monitor. I don't think it's necessarily a bad thing. And this is, again, it's one of those things that, I'm sorry, it's going to be kind of it depends type of answer. And I think one of the things to consider is that America has traditionally, we've been sleep depriving ourselves for years. Like the average of sleep amount is like somewhere in the 6-hour range, and on average humans need about 8 hours. So part of the increased sleep might just be catching up on sleep loss. We don't have to commute anymore, don't have to do things like that. That is something that I think is okay. right? You want to make sure it doesn't get out of control. And so that is when people find themselves sleeping more and it's starting to be like, whoa, this is a little weird. I'm sleeping 10 hours. Otherwise, I feel okay. That's when I would start talking to them about just making sure that they're planning the hours, right? Sticking to that regular routine. So if they're usually going to bed at midnight, waking up, and usually wake up at 8 a.m., but they find themselves sleeping until 10 a.m., well, they might be catching up on sleep, so maybe they should fall asleep a little earlier, or maybe after a few weeks of catching up on sleep, it'll kind of reset itself. Obviously, what you want to look out for is kind of that depressed oversleeping, when people are feeling depressed and staying in bed all day, whether or not they're really sleeping or not. So with that again, you just really want to get back to as a feature of treating their depression and in treating their sleep behavior, you definitely want to stick to that, maintain a regular routine, and try to explain to them why it's so important to be getting out of bed at the same time every day, and try to get them down to a routine. And if they're struggling with not getting enough sleep, it really, what I could say is it takes about 2 weeks to really change your sleep behavior for like the long term, and so that's just something that you can try to work on with them doing, and just try to reinforce that it's something that should be able to be done. Okay. I see a question about cannabis use. That's a great question. It is definitely skyrocketing. I have several friends that work at dispensaries that have said that they're just like out of stock. I know a lot of places have reduced all the way to just medical marijuana use. And the answer I have is I don't know. Like I don't think we know real yet. The research has not been done well enough to know how cannabis really truly affects our sleep. There's a few studies out there that seems to indicate you're not getting the best quality of sleep when using cannabis, but frankly, it's just not well enough for me to say either way if it's a problem or not. So one of the things I would recommend doing is just kind of monitor them, see how they're doing as far as fatigue, and again, your clients better than me if they're using it as a way to reduce stress and it helps them fall asleep, and seemingly they're functioning fine. Other than that, their mood is okay. Far be it from me to tell them that's a bad idea. I just don't think the research is there yet to be able to say. It's a great question. The survey is still open for recruitment across the whole world. Anybody can still sign up. This is not a recruitment event, though. I want to make that clear. I'm just answering the question that it is still open for recruitment. And then you can find, if you look up, kind of Google around on Boston. I don't have like a link or anything, but Boston College coronavirus type questions, it should pop up at some point. So is the survey related to or appropriate in identifying a sleep disorder? I would not say so. No, I usually, as far as is applying it clinically, there are some really good measures out there. The ones I would recommend is there's a restless leg survey. There's a STOP survey, which is just 4 questions. It helps you look for sleep apnea. There's Pittsburgh Sleep Quality Index, and then there's the Insomnia Severity Index, and then there's several other ones. The best recommendation I would have would be to give kind of a battery like that, and we do not have all of those in the survey that I'm currently giving to get like the full range. So that's a great question, but there are lots of good surveys out there, and maybe as part of this follow-up email, I'll make a quick list of my recommended ones for people that are looking for some quick surveys to help with diagnosis. I can't share the survey again. I'm just informing you about it as much as I appreciate the interest. So I saw another question. How long does it usually take for new and improved sleep habits to benefit the sleeper? Like I said, about 2 weeks. If you're really good and consistent about it, it can actually be pretty quickly. Those of you that are parents that have had young babies may have even seen it be faster. My daughter was a terrible sleeper and just absolutely awful, and ironically, I know. And then we finally committed to kind of a sleep routine, and it was 4 days. It took 4 days for her to kind of shift into the new routine. A couple of nights of 90-minute plus screaming in my face, and then chipped away down to like 20. And so for older adults, I would say about 2 weeks is what you can about expect. That's a great question. All right. I tried to get through as many as I could, and I will do my best to answer all these via email that they send out. So I'll just ask the staff to go ahead and compile the questions for me, and I'd be happy to send as many responses as I can get a chance to do. Thank you again all for your time and attention, and thank you MHTTC for hosting me and letting me talk a little bit about this. And I hope you all get some good sleep coming up here. I know it's going to be a little bit tough.
Yeah, thank you all so much for attending today's webinar. You'll be receiving an evaluation form right afterwards, and we also have a few upcoming events, so please feel free to register if you're interested. Thank you again, everyone.